How to quarantine yourself, self-care and disease prevention. The thought of going into quarantine may sound scary, but it's a simple precaution to protect yourself and others from contagious diseases. If you live in an area that's affected by an infectious disease outbreak, such as the recent COVID-19 pandemic, health officials may recommend that you practice social distancing, or limit your time in public in order to protect yourself. If you get sick or might have been exposed to the disease, you might need to go into quarantine or isolate yourself at home until the danger of spreading the infection to others has passed. Stay in touch with your doctor and reach out to friends and loved ones to help put your worries at ease and relieve stress while you're waiting for your quarantine period to end. Method 1. Protecting yourself with social distancing. 1. Stay at least 6 feet (2 meters) away from obviously sick people. Many contagious diseases spread when people spend time around infected people, even if they don't actually have any physical contact. This can happen when an infected person coughs or sneezes and people around them breathe in droplets of saliva or mucus from their nose or mouth. If you're around someone with symptoms of illness, like sneezing or coughing, avoid touching them and try to maintain a distance of at least 6 feet (2 meters) at all times. 2. Wash your hands frequently when you're in public areas. Washing your hands is one of the easiest and most effective ways to protect yourself and others from the spread of disease. If you are in a public space or another area where you know you might be exposed to an illness, wash your hands often with soap and running water. Wash your hands for at least 20 seconds, and make sure to wash your wrists, between your fingers, and the backs of your hands. 3. Keep your hands away from your face as much as possible. Many viruses and germs enter the body through the mucous membranes in your eyes, nose, and mouth. To prevent this, avoid touching your face as much as possible, since your hands may have come into contact with a contaminated surface. 4. Cover your mouth and nose if you cough or sneeze. Even if you don't think you're sick, it's important to protect others in your community and set a good example by practicing proper hygiene when you cough and sneeze. Cover your mouth and nose with a tissue, then immediately throw the tissue away. Wash your hands or use hand sanitizer when you're done. 5. Avoid crowded areas if you're at high risk or if local health officials recommend it. In some cases, local health authorities may cancel large events or advise that people limit their time in public spaces in order to prevent the spread of disease. You may also need to limit your exposure to crowds and public areas if you're particularly vulnerable to infection. If you're not sure whether it's a good idea to go out in public, ask your doctor for advice. 6. Get recommendations on social distancing from reputable public health websites. If you live in an area that's affected by an infectious disease outbreak, such as the COVID-19 virus, visit your local public health website for updates and information. They will provide information about how to protect yourself and others from illness and will let you know whether social distancing is necessary. Method 2. Practicing self-quarantine after exposure to a disease. 1. Self-quarantine if you've been exposed to an infected person. If you know that you have been in close proximity to someone with a dangerous infectious illness, such as COVID-19, it's a good idea to self-quarantine in order to protect yourself and others. If you think you've been exposed to a contagious disease during an outbreak, contact your doctor or local public health department and ask if you need to quarantine yourself. 2. Call your doctor immediately if you suspect you're sick. If you think you've been exposed to a disease like COVID-19 and you start to experience suspicious symptoms, call your doctor's office and explain the situation. They may ask you to come in for a medical evaluation and testing, and they can also give you advice about whether self-quarantine is necessary for you. 3. Stay home for 14 days or as long as your doctor recommends. The typical recommended time for self-quarantine is 2 weeks. This will give you plenty of time to monitor your condition and determine whether you might pose a risk to others. If your doctor advises you to self-quarantine, ask them how long you need to stay home. 4. Avoid contact with other people or animals as much as possible. During your quarantine, it's very important to keep to yourself so that you don't risk making other people sick. Even if you don't have any symptoms, avoid having visitors and keep your distance from other people who live with you. Limit contact with your pets as much as you can, including petting, cuddling, feeding, and grooming them. 5. Wear a mask if you have to be around other people. Even if you don't have any obvious symptoms of illness, wear a face mask during your quarantine to reduce the risk of spreading a possible infection to others. Put on a mask if someone is visiting you, a family member has to enter your room, or you need to leave your home in order to get medical treatment. 6. Wash your hands frequently with soap and warm water. Protect both yourself and others from the potential spread of disease during your quarantine by washing your hands regularly. Wash your hands for at least 20 seconds, especially after you cough, sneeze, or blow your nose, after you go to the bathroom, and before you prepare or eat food. 7. Cover your mouth and nose whenever you cough or sneeze. If you have to cough or sneeze, prevent the spread of potentially contaminated fluids from your mouth and nose by covering your face with a tissue. If you don't have a tissue, cough or sneeze into the crook of your arm. 8. Disinfect objects and surfaces you come into contact with. Once a day, use a household cleaning product, such as a disinfectant wipe or general-purpose cleaner, to clean surfaces that you use regularly throughout the day. This includes things like doorknobs, counters, tabletops, light switches, and toilet seats. 9. Monitor your condition closely and get medical help if anything changes. While you're in quarantine, keep a close eye out for any signs that you may be getting sick or that your condition is worsening. If you notice new or worsening symptoms, call your doctor right away and ask for advice. Method 3. Self-isolating if you're sick. 1. Ask your doctor if you can return home or if you need to be hospitalized. If you have a confirmed diagnosis of a contagious illness such as COVID-19, your doctor will need to evaluate your specific case and make recommendations based on your condition. Discuss whether you can safely go home and, if so, whether you need to stay in isolation until you recover. 2. Stay home unless you need to seek medical care. If you're sick, it's imperative that you stay home and rest as much as possible. This will help you recover faster and also protect others from catching your illness. Don't go to school or work, and avoid taking public transit to visit the doctor if possible. 3. Remain in your own room as much as possible if you share a home. If you can, keep to your own space inside the home and don't allow pets, visitors, or family members inside. If possible, use your own bathroom instead of sharing one with other people in the home. 4. Wear a mask if you have to interact with other people. If you're too sick to care for yourself, put on a mask anytime a caretaker has to be around you. You should also put on a mask if you have to leave your home, e.g., to visit your doctor's office. 5. Practice proper hygiene to prevent spreading your illness. While you're in isolation, keep your environment clean and take precautions so that you don't pass your infection to others in your home. 6. Call your doctor immediately if your symptoms change or get worse. While you're in isolation, you or your caretakers will need to monitor your condition closely. If you develop new symptoms, start feeling worse, or don't see any signs of improvement after the expected period of recovery time, call your doctor right away. They can advise you about what to do next. 7. Work with your doctor to determine when you can leave isolation. The length of your self-isolation will depend on your specific situation and symptoms. Even if you feel much better, don't leave your home until your doctor says it's safe. This will help protect both you and other people in your community. Method 4. Coping with self-quarantine. 1. Remind yourself that difficult emotions are normal during self-quarantine. Dealing with a dangerous disease outbreak is scary and stressful, and having to quarantine yourself can make those feelings worse. It's normal to feel fearful, sad, frustrated, lonely, uncertain, or even angry about what's happening. If you experience any of these feelings, try to acknowledge them without judging yourself. 2. Reach out to your doctor if you have questions or concerns. If you're feeling fearful or uncertain about what's happening, your doctor may be able to put your mind at ease. Don't hesitate to call your doctor's office or reach out to someone in your local public health department if you have questions. 3. Talk to your employer if you're worried about loss of income. Having to miss work because of self-quarantine, self-isolation, or enforced social distancing can put you under financial stress. If you're worried, reach out to your employer about your situation. Give them a clear explanation of why you need to miss work and provide a doctor's note if necessary. 4. Stay in touch with your friends and family. Being in quarantine or isolation can be extremely lonely. Being alone while you're ill or fearful of becoming ill can also increase your feelings of anxiety or frustration. Reach out to friends and loved ones by phone, email, social media, or video chat so that you don't feel so alone. 5. Practice stress-relieving activities to help you relax. To fight boredom, anxiety, and frustration, look for simple, enjoyable activities that you can do while you're stuck at home. Depending on how well you're feeling, this might include things like watching movies or TV shows, reading, listening to relaxing music, playing games, meditating, or doing light stretches or yoga, working on hobbies or creative projects, doing light housework.